Thank you very much, Presiding Officer. First of all, I think just on the back of Martin Whitfield's comments with regards to the 5 bills to be introduced, I think just for completeness, there are 2 bills already introduced in this session. 2 bills have still to be introduced in addition to the 14 bills already in the parliamentary process. So it does highlight that this Parliament will be busy over the course of the next year. Very briefly,
Martin Whitfield.
Take an intervention, and of course that was my request, to move the care bill forward so that there was space for these new bills to be finalised along with the others. Would you welcome that?
Stuart McMillan.
Okay, thank you. Presiding Officer, I am pleased to speak in today's debate following the First Minister setting out his clear vision for our country and also for the people who live here. And I want to focus most of my contribution on an issue first raised with me in 2018 by one of my constituents, Jill Best, who is a nurse who has worked in medical aesthetics since 2010. Now, at the time, I was surprised to learn that injectable treatments using prescription-only medicines were being offered without any regulatory framework. And that's why I really am delighted with the announcement that the Scottish Government is to legislate in this area. The introduction of the non-surgical cosmetic bill will be welcomed by many people across the country, and I know it also does have cross-party support. We've obviously just heard from Martin Whitfield. I also know that Mellis Briggs MSP, Ross McCall MSP, in addition to my own colleague Colin Beattie MSP, have all been involved in supporting this particular campaign. I also want to thank Jenny Minto MSP, the Public Health and Women's Health Minister, for meeting and listening to the campaigners from the sector, and also for helping to get this bill into the programme for government. So thank you, Minister. The bill will help deliver a safer non-surgical cosmetic sector, and a sector that will be safer for all of its clients. That's everyone who lives in Scotland. Now, the industry has grown significantly since my first discussion with Jill Best, and yet the lack of regulation leaves authorities uncertain about the industry's actual size in Scotland. This is why regulation is so critical, not only for improving patient safety, but also for gaining oversight into the number of businesses offering these treatments at the moment. Now, having recognised these concerns earlier, I repeatedly wrote to the Scottish Government highlighting Jill's worries and emphasising the need for action. So the non-surgical cosmetic sector is here to stay, and it will continue to expand. So it does make the legislation absolutely imperative. Now, the reports of botched procedures, as we will all know, we've read the papers, we've seen the items online. So these reports, including tragic fatal cases, have fuelled concerns about unqualified practitioners. So this is deeply concerning, and it risks misleading patients into thinking that the sector currently is totally safe, when obviously there are individuals who are operating who are not properly qualified. Now, I will go on to touch upon another couple of issues, and that's the other aspects in this programme for government. It certainly struck me by the contrast between the politics in Scotland and also the rest of the UK. Now, our First Minister reiterated his commitment to eradicating child poverty while growing the economy, investing in public services, and also tackling the climate emergency. Now, meanwhile, prior to July 2024, the UK had a government that actively worked against these priorities. Now there is a Labour government in Westminster that has failed to deliver on its election promises. Now, I remember Mr Sarwar assured the nation, "Read my lips, no austerity under Labour." His silence is deafening, and the fact that the Welsh Labour First Minister is calling out her UK Labour government colleagues speaks volumes. So I welcome this programme for government, and I certainly look forward to working with colleagues across the chamber as the bills proceed through the Parliament. Thank you very much.